Well, everybody, this is Gary. Today is November 8th, 2021. It's 7:16 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today I'm doing okay. My hallucinations are not that bad. My auditory hallucinations. I'm not someone who has visual hallucinations. That's never really been a problem. My anxiety levels are pretty low. Um, my delusions are less intense. I don't feel particularly paranoid right now. Um, my depression is not that bad. Um, I suspect that I'll be able to get some sleep tonight. I've been able to sleep pretty well over the past couple of days. This past weekend wasn't as bad as the weekend before when I went to the psychiatric emergency room. Um, The main thing I'm dealing with is the same thing I'm always dealing with, which is side effects of my psychiatric medications, which I wanted to talk a little bit about. Um, I'm on quite a bit of Seroquel, which is an antipsychotic and also can be used as a mood stabilizer for mood swings, which I get because I have schizoaffective disorder. Schizoaffective disorder is sort of like a combination of schizophrenia and bipolar disorder. Um, I'm on 600 milligrams of Seroquel. The maximum amount that most psychiatrists are willing to prescribe is about 800 milligrams of Seroquel per day. I actually went up to 1,000 milligrams at one point per day because I smoke cigarettes, or I used to smoke cigarettes, and cigarettes tend to interfere with what Seroquel is supposed to do, and then it actually reduces the amount of Seroquel in the blood. I also take Zyprexa as needed for psychosis. My hallucinations, my delusions, when they get really bad. Of course, I mentioned before I take Klonopin as needed for anxiety. Um, I take Neurontin for anxiety. I know most people don't associate taking Neurontin with anxiety, but my psychiatrist believes that it does help with my anxiety. Um, I'm on several different medical medications, two of which is Protonix, which I take for acid reflux disease and a history of stomach ulcers. I'm also on a medication that I can't recall the name of right now, but it's for high blood pressure. I generally have high blood pressure, um, and I take 2 tablets of a medication that I can't for the life of me remember the name of right now, but I take it for high blood pressure. I have to take laxatives because of my psychiatric medications can cause constipation, which usually obviously isn't that serious. Most people get constipated from time to time. With my psychiatric medications, I've actually had to go into the emergency room for constipation because if I don't have a bowel movement in 3 or 4 or 5 days, that can be a medical emergency. And I've actually had to go to the emergency room and have done what's called a soapy water enema. They basically take a long plastic tube, stick it up your butt, flush out your intestines with soapy water, and that releases everything that's backed up in the intestines. I've had blocked intestines when the stool gets really hard and lodged in place and I can't have a bowel movement. That's generally caused by my psychiatric medications. I'm on multiple psychiatric medications. Of course, some of the other side effects include drowsiness. 600 milligrams of Seroquel is quite a bit, and it can obviously cause me to be drowsy. Um, Zyprexa can be sedating as well, which actually can help me sleep as well as reduce my hallucinations and delusions, but Zyprexa can cause drowsiness. Obviously, Klonopin is a benzodiazepine tranquilizer for anxiety that can cause drowsiness. Um, the main side effects that I'm dealing with my personal psychiatric medications are the constipation and the drowsiness. I generally don't have to deal with other side effects. For about 4 or 5 months this past earlier part of this year, I was having problems with urination, and it turns out it was because I had diverticuli in my urinary bladder, which had to be removed surgically. So I had to start urinating again. But psychiatric medications, depending on which ones you're talking about, can cause difficulty urinating. And so my psychiatrist reduced my Seroquel from 1,000 milligrams a day to 600 milligrams a day on the idea that it might have been contributing to my difficulty urinating. As it turns out, it was really mostly my bladder problems that were making it impossible for me to urinate. And I had surgery to correct that, and I'm urinating normally again. But psychiatric drugs can cause difficulty in urination as well as constipation, either one of which can be a medical emergency. Obviously, if you can't urinate, urine backs up into the kidneys, and that can, well, kill you. I had to wear a urinary catheter 24 hours a day for 4 months, and the catheter wasn't taken out permanently until I had surgery on my bladder. We did surgery on my prostate, and that didn't by itself allow me to urinate normally. So we moved on to the urinary bladder, and I had surgery on my bladder. But in any event, psychiatric medications can cause difficulty in urinating. I don't think my psychiatric meds played a big role in my difficulty in urinating. It was mainly my bladder problems. My urinary bladder had pieces of my bladder were stretching out like water balloons and trapping the urine, making it impossible for me to pass urine. So the main side effects that I was dealing with my psychiatric medications, and I'm still dealing with, is potential for constipation and the drowsiness. I generally don't really have any other serious side effects from my medications. Now, when I was on Haldol, I had what's called akathisia. That's a need to feel like you have to be in constant physical motion. It's a very strong sense of physical restlessness and inability to sit still. And so I stopped taking Haldol. It's an older psychiatric medication, and it really had some nasty side effects, including the akathisia, which was really uncomfortable. I was always pacing back and forth. I couldn't lie down. I couldn't sit still. It was driving me crazy. So I told my psychiatrist that I was going to refuse to take any more Haldol. Other drugs that can cause that are things like Thorazine, Stelazine, Prolixin. Those are all some of the older typical psychiatric antipsychotic drugs, and I generally don't take the older antipsychotic drugs. I take some of the newer, what's called atypical antipsychotic drugs, Seroquel, Zyprexa. No, the Neurontin, of course, is a different drug altogether. It's generally not an antipsychotic drug, and most people take it for things like neurological pain, migraines, that kind of thing. I take it to help with my anxiety. Um, I've even talked to doctors who said they've never heard of Neurontin being used for anxiety, but I talked to one or two psychiatrists that believe it can help with anxiety. Of course, I'm not a psychiatrist. I'm not giving medical advice. I'm just going through the list of medications that I take, their uses for me, and the side effects that I experience. But generally, the only two side effects I experience are the drowsiness and the constipation. I take 3 different laxatives every day, 3 times a day. I take Miralax, which is just generally a stool softener. Comes in powder form. You just pour it in water or orange juice or soda or whatever you want to put it in. Dissolve it and then you drink it. I drink it 3 times a day. I take a stool softener 3 times a day, Colace in pill form, and I take a stimulant laxative, Senna, 3 times a day. I find those 3 drugs together pretty much keep me out of the emergency room and prevent any emergencies where I have to have a soapy water enema. I haven't had to go to the emergency room for constipation for several months, so I'm doing pretty good in that area. But it's always something that I have to keep an eye on. So those are some of the side effects of the psychiatric drugs that I take. There are, of course, side effects to the medical drugs that I take, which I'm not going to get into right now. But I also take ibuprofen for pain. Sometimes one of the dangers of ibuprofen and drugs like it is it can cause stomach bleeding, which I've had. I was once taking way too much aspirin on a daily basis, which is a different drug than ibuprofen, and it caused me to have really severe stomach bleeding. I was running up pure blood. I almost bled to death. So that's why I take the Protonics for the stomach acid, the acid reflux, the potential for stomach bleeding, that kind of thing. I have to be careful when I take ibuprofen because it can also cause stomach bleeding. But Tylenol helps with pain, but it doesn't help with inflammation. So when I have pain and inflammation, ibuprofen, also known as Motrin and Advil, helps with inflammation as well as pain. But I do have to be careful when I'm taking ibuprofen because it can cause stomach bleeding. Again, I'm not a doctor. I'm not giving you medical advice. I'm just going through the list of medications that I take. Like, comment, share, subscribe. Share my videos on social media to help my channel grow. Press the notification bell if you want to know when I put out new videos. And if you want me to do a video on a specific topic, let me know in the comments.